minus 31 right now, and that will be the case all day. We will be expecting wind to continue getting as cold as minus 36 as we head into the morning. Overnight, low of minus 32 again. Right now, minus 22 with the wind, minus 31.
All right, so still a cold start out there. Be sure to bundle up. We will speak with a professor in the University of Alberta's Ultra Cold Lab in the final half hour of the show. And an Edmontonian is making an appearance in season 4 of the Great Canadian Baking Show. Spoiler alert, we've already been eating some bread that Larry has made us, Larry Harris, that is, made us this morning. It is delicious. Just a bit of a humble brag for you at the end of this hour. But we'll be back with both of those stories and more here on Edmonton AM.
This is World Report. Good morning from CBC News. I'm Marcia Young. This morning we are expecting to learn more about Ottawa's new travel restrictions. 2 weeks ago, Prime Minister Justin Trudeau announced air travelers arriving in Canada would be required to quarantine in government-designated hotels. Our colleagues at Radio Canada are reporting this will begin Monday, February 22nd. The CBC's Evan Dyer is following developments. Evan, tell us more about what the Prime Minister is expected to say.
The Prime Minister and other ministers today are expected to flesh out the details of Canada's mandatory hotel quarantine scheme for returning travelers. And we're told, Marcia, there will also be new details for both air and land travel restrictions. Now, we know the broad outlines of the hotel plan for air travelers already. It's 3 days mandatory quarantine in a government-approved hotel awaiting the results of a PCR test. If that test comes back negative, the traveler can do the remainder of a 2-week quarantine at home. So since we know those details, perhaps the more significant fact today is that this means that the program announced 2 weeks ago is now ready to go into effect. To do this, of course, the government needed to designate specific hotels and then prepare those hotels. And the window for hotels to apply to participate in this program closed Wednesday night. So that suggests this list is now complete. All hotels will be in one of 4 hubs: Toronto, Montreal, Vancouver, and Calgary. We may also learn more about the cost associated with this hotel stay. We know it isn't cheap. We know it's somewhere in the range of $2,000 just for those first 3 days. The government has been pretty clear it isn't trying to make this system affordable. Or to being complaints from people who do have to travel about conditions in some quarantine hotels that are already in use for people who can't present a plan to quarantine at home. And yesterday, Marcia, we saw a Calgary law firm file a lawsuit against the program before it really gets even up.
Thank you, Evan.
Thanks.
CBC's Evan Dyer in Chelsea, Quebec, and you can watch the Prime Minister, Justin Trudeau, live at 11:30 Eastern on CBC News Network. Just as the pandemic was starting to take hold in Canada last March, Ottawa turned down a chance to buy a reliable supply of N95 face masks. That decision came as medical professionals across the country scrambled to find protective equipment. John Paul Tasker reports.
Federal bureaucrats working at the Public Health Agency of Canada rejected an offer to buy up to millions of N95 masks last March, just as the country was shutting down in the face of mounting COVID-19 caseloads. Provinces were scrambling to find masks for healthcare workers. Honeywell, a multi-billion-dollar company with a history of making respiratory equipment, was offering a steady supply. The company said it would give Canada access to a production line at its plant in Tijuana, Mexico. But a staffer for Public Services and Procurement Minister Anita Anand said the government had enough masks already. Right now, N95 masks are not the priority. Kelly Murdoch, a senior policy advisor, said in a March 19th email. Dr. Zain Chagla is an infectious diseases physician. He says it was obvious to all frontline healthcare providers that Canada desperately needed more of this equipment. Chagla said doctors were forced to reuse masks and get creative with cleaning.
N95s were a priority in March. Again, we were talking about things like reuse, like putting in microwaves, like disinfection. All of us could tell our shipments were not coming in.
A spokesperson for the Public Health Agency did not respond to CBC News questions by deadline. While slow to start, N95 delivered.